Chest pain is one of the symptoms people fear the most. Sometimes it is caused by stress, acid reflux, muscle strain, anxiety, or lack of sleep. But sometimes chest pain can be the first warning sign of a heart attack or another serious emergency. The dangerous part is this: you cannot always tell the difference by pain intensity alone. A mild discomfort can still be serious. A burning sensation can still matter. A pressure feeling in the chest can be a warning sign. And some people, especially women, older adults, and people with diabetes, may not have the classic heart attack symptoms. In this video, we will use AI-assisted health education and evidence-based medical research to explain 7 chest pain warning signs you should never ignore. AI can help organize symptoms and risk factors, but AI cannot diagnose or rule out a heart attack. If you think your chest pain may be serious, seek emergency medical care immediately. Let's begin. 1. Sudden pressure, tightness, or crushing chest pain. The first warning sign is sudden chest pressure, tightness, heaviness, or a crushing sensation. A heart attack does not always feel like sharp pain. It may feel like something heavy is sitting on your chest. It may last more than a few minutes. It may go away and come back.
It may feel different from anything you have experienced before.
The 2021 AHA-ACC Chest Pain Guideline emphasizes that chest pain should be evaluated using structured risk assessment, not guesswork. Doctors consider symptoms, risk factors, ECG findings, and cardiac troponin testing. This is why AI should never say, "This is definitely just anxiety," or "This is definitely a heart attack." The safe approach is risk recognition. If chest pressure feels intense, unusual, persistent, or different, do not wait. 2. Pain spreading to the arm, jaw, neck, back, or shoulder. The second red flag is chest pain that spreads. Heart-related pain may radiate to the left arm, both arms, shoulder, neck, jaw, upper back, or even the upper stomach. A heart attack does not always stay in the center of the chest.
It can feel like jaw pain.
It can feel like shoulder pain. It can feel like upper back pressure. It can feel like indigestion. A 2020 paper in the Journal of the American Heart Association discussed typical and atypical symptoms of acute coronary syndrome. It noted that chest, arm, or jaw pain may be described as dull, heavy, tight, or crushing. It also emphasized that symptoms often called atypical are more common in women evaluated for myocardial infarction and may contribute to delayed diagnosis. So, if chest discomfort spreads to the arm, jaw, neck, back, or shoulder, especially with other symptoms, take it seriously. 3. Chest pain with shortness of breath. The third warning sign is chest pain with shortness of breath. Shortness of breath may happen when the heart is not getting enough oxygen, when the lungs are involved, or when the body is under serious stress. The 2023 European Society of Cardiology Guidelines for Acute Coronary Syndromes highlight that acute coronary syndrome can present differently from person to person and requires structured evaluation. AI can help ask the right safety questions. Are you short of breath? Is the chest pain new? Did it start suddenly? Are you sweating? Are you dizzy? Do you have heart disease risk factors? But AI cannot safely rule out a heart emergency. Chest pain plus shortness of breath should be treated as a warning sign. 4. Chest pain with cold sweat, nausea, or vomiting. The fourth red flag is chest pain with cold sweat, nausea, or vomiting. Many people do not connect nausea with heart problems. They assume it is food poisoning, acid reflux, or stomach trouble. But heart attacks can cause nausea, vomiting, sweating, and a sudden feeling that something is seriously wrong. The fourth universal definition of myocardial infarction explains that heart attack diagnosis is not based on symptoms alone. It requires evidence of acute myocardial injury, usually involving cardiac troponin changes, together with clinical evidence of ischemia. That means symptoms alone are not enough for diagnosis. But symptoms still matter because they are often the reason people seek help. If chest pain comes with cold sweat, nausea, vomiting, or sudden severe discomfort, do not try to self-diagnose at home.
Get medical help.
5. Chest pain with dizziness, fainting, or extreme weakness. The 5th warning sign is chest pain with dizziness, fainting, or sudden extreme weakness. This can happen when the heart is not pumping effectively, when blood pressure drops, or when the heart rhythm becomes abnormal. Fainting with chest pain is never something to casually watch at home.
Emergency doctors look at the full risk picture.
That is why clinical tools such as the heart score were developed. The heart score considers history, ECG, age, risk factors, and troponin. A 2013 prospective validation study found that the heart score was a useful predictor of short-term major adverse cardiac events in chest pain patients. AI can help organize this information,
but only medical professionals should use these tools to guide real decisions.
If chest pain is associated with fainting, dizziness, or severe weakness, seek urgent care. 6. Chest pain in high-risk people. The 6th red flag is chest pain in someone with high-risk medical history. Chest pain becomes more concerning if you have diabetes,
high blood pressure, high cholesterol,
smoking history,
obesity,
known heart disease,
previous heart attack, family history of early heart disease,
chronic kidney disease,
older age.
Risk factors change the meaning of symptoms. The same pain can mean different things depending on the person. The TINI risk score, published in JAMA in 2000, and the GRACE risk model, based on large acute coronary syndrome registry data, both show that chest pain risk assessment is multifactorial. Doctors look at symptoms, age, medical history, ECG, troponin, blood pressure, heart rate, and other clinical information. AI can help collect risk factors, but a doctor must interpret the risk. If you are high risk and develop new chest pain, do not dismiss it. 7. Chest pain that feels different, gets worse, or does not go away. The 7th warning sign is chest pain that feels different from usual, gets worse, or does not go away. A new pattern matters. Pain that is stronger than usual matters. Pain that lasts longer matters. Pain that happens with less activity matters. Pain that wakes you from sleep matters. Pain that does not improve with rest matters. High sensitivity cardiac troponin is now central to modern chest pain evaluation. A 2018 JACC study validating the ESC 0 to 1 hour algorithm showed that high-sensitivity troponin-based strategies can help triage suspected heart attack patients in appropriate clinical settings.
But troponin is a medical test. ECG is a medical test.
Risk scores are clinical tools. They cannot be replaced by online guessing.
If chest pain is new, worsening, persistent, or very different from your usual symptoms, seek medical evaluation.
Summary.
Here are the 7 chest pain warning signs you should never ignore.
1. Sudden pressure, tightness, heaviness, or crushing chest pain. 2. Pain spreading to the arm, jaw, neck, back, or shoulder. 3. Chest pain with shortness of breath. 4. Chest pain with cold sweat, nausea, or vomiting. 5. Chest pain with dizziness, fainting, or extreme weakness. 6. Chest pain in high-risk people, including those with diabetes, high blood pressure, smoking history, high cholesterol, or known heart disease. 7. Chest pain that feels different, gets worse, or does not go away. Most chest pain is not a heart attack. But the wrong chest pain can be life-threatening. Do not wait for the pain to become unbearable. Do not try to prove it is only stress. When dangerous warning signs appear, time matters. AI helps you understand medical information. Doctors diagnose and treat disease. Emergency care saves lives. This video is for educational purposes only and does not provide personal diagnosis, treatment, or emergency medical advice. AI-assisted analysis cannot replace a licensed healthcare professional. If this video helped you understand chest pain warning signs, please like this video and subscribe for more evidence-based AI health education. Comment below, what symptom should we explain next? Headache warning signs, stroke symptoms, shortness of breath, high blood pressure, or abnormal blood test results. Your comment may become the topic of our next video.